Hey to everyone, I am here with a science lesson for 5th standard and the name of the lesson is Safety and First Aid. Safety and First Aid. All of you are familiar with first aid, isn't it? When you are traveling in a bus or even in the school, you see a box in the principal's office or in the manager's office. In the bus you see it behind the driver. It is written as FA box, that means first aid box. And there some things are kept. That is, if when there is an accident, if and when there is an accident, immediate relief or medical aid is administered to the patient or the injured persons, and that is known as first aid. It is a compulsory to have a first aid box in the vehicles and also in institutions and other offices. Now let us begin safety and first aid on page 206. The first question there in the box is, write 6 items that you can put in a first aid kit. So there are 6 items generally that are used in a kit, a first aid kit. So the first one is band-aid or bandage, either the tying one or the sticking one. Second one is the antiseptic lotion, Dettol. Then you have the pain balm, you can keep Bernol or you can keep Iodex. Then you have a pair of scissors, you have cotton, plain roll of cotton, and then you have iodine, tincture of iodine, that is used as a, you can say, antiseptic. These are the basic 6 things that you can keep in a box, and sometimes you can keep tablets for a headache or crocin or paracetamol, but we need to see the expiry date before we administer it to the injured person. Then you can also keep a box of Vicks or you can say Amritanjan for headache. Now let's get on to the lesson. Accidents and injuries can occur suddenly and can be dangerous. They usually happen when we are careless. To avoid accidents, we must follow safety rules and must also know what to do in case of accidents and injuries. Accidents and injuries can occur suddenly and can be dangerous. They usually happen when we are careless. To avoid accidents, we must follow safety rules and must also know what to do in case of accidents and injuries.
First aid treatment. Harry tells his father that he wants to know how to treat people using first aid. Therefore, his father starts explaining to him about first aid treatment. For instance, if an animal, like a dog or a cat, bites someone, the wound should be allowed to bleed for some time so that the germs will flow away with the blood. Then, the wound should be cleaned with soap and water, some antiseptic lotion must be applied on the wound, and the area should be covered with a bandage. In case of a dog bite, we should check whether the dog is vaccinated against rabies or not. If not, the person must be given anti-rabies vaccine. Father then tells Harry that if a bee, wasp or hornet stings someone, then the area should be first washed with soap and water. The sting should be removed and then the sting site should again be washed with water. An ice pack should be applied to relieve pain and swelling. As an alternative, we can also apply a paste of baking soda and water on the sting site. Father then tells that in addition to bites and stings, we can also give some immediate help for fracture and sprain. Here, Harry remembers that in school, one of his friends fell down while playing and his hand got fractured. The teacher told him not to move his hand and, with the help of a splint, she gave support to his hand. Then he was taken to a doctor. Father tells Harry that this is a kind of first aid treatment that can be applied in case of a fracture, that is, breaking of bone, or a sprain, that is, an injury to muscles like wrist ankle, etc. But care should be taken that the area is not rubbed, as that can lead to more injury.
First aid. So now we come to first aid. First aid may be necessary for someone who has been injured or taken ill suddenly. The immediate help given to an injured person before a doctor arrives or the person is taken to the hospital is called first aid. First aid may be necessary for someone who has been injured or taken ill suddenly. The immediate help given to an injured person before a doctor arrives or the person is taken to the hospital is called first aid. So in school, where a child falls down and cuts her finger, the first thing that the teacher or the principal or the auntie does is take the child to the principal's office or the manager's room and administer first aid. The wound is washed with water and Dettol, and then immediately some pain balm or is applied with a piece of cotton, and then either the wound is not left open for a long time, just put a slight bandage so that it is not getting infected with germs, and then the child is taken for further examination to the nearest medical center. First aid can help an injured person in the following ways. It can save a person's life, it can prevent the injury from getting worse, it can reduce the pain of the injured person till medical help arrives. Let us learn about first aid for some common injuries. Now, some common injuries like the nose, cuts and wounds, then if you fall down and break your hand, fracture, some common injuries and how first aid should be administered is given in the text which we are going to read through. Cuts and wounds. Follow these steps if you or someone has had a cut. Wash your hands with soap and water before touching the wounds. Germs can enter the body through these cuts. So immediately it is to disinfect the cut and the wound, we wash with soap and water. Wash the wound with clean water. Dry the wound with a clean cloth. Apply some antiseptic cream on it. If it is a minor cut, cover the wound with a band-aid or cover it with a cotton pad and bandage it firmly. If the wound is deep, call the doctor. If the wound is deep, you may have to get stitches done, and then you have to call a doctor. So you can see the pictures there. Washing the hands with soap and water, then applying the antiseptic and then bandaging the cut part of the hand. Now, nosebleed. If someone has a nosebleed, follow these steps. Make the person sit in an upright position. That means in a straight position, because if the person sits like this, bleeding will automatically be reduced. But if the person lies down, that is going to be bad. With her head slightly bent backwards. Press a clean handkerchief firmly over the nose, that is to stop the bleeding. Put an ice pack over the bleeding nose, that is also one method to stop the bleeding. Make sure that the person breathes through the mouth for a few hours. So when you cover the nose with a handkerchief, you close the nostrils, and what happens immediately, automatically the person tends to breathe through the mouth. Let's get on to the next one, that is fracture. Fracture is when you run or when you're walking, you slip and fall and immediately your hand or leg is broken. As soon as there's a fracture, what happens immediately is that part or swells up and there's very bad pain. So when it swells up, immediately you know that it is a fracture, and then you don't have to move that part. It has to be kept without movement. So the best thing that time is to tie a sling and hang it around your neck, or you have to try a splint here and keep the hand without moving. Fracture. A crack or a break in bones is called a fracture. The symptoms of a fracture are pain, swelling or discoloration. If you think someone has a fracture, follow these steps. Tie a stick or a splint to support the broken bone. If a splint is not available, use a cloth as a sling to support the broken bone. Now, if you don't get a piece of wood or a splint, that is a strong piece of wood to tie on the arm and give it support, you have to put a sling, that is you put a cotton cloth or a cotton piece of cloth round this arm, round the neck, so that it is like this in this position and it will not move. Because you don't have to make the arm move. Once it moves, it causes a lot of pain and the injury can get severe. Next one, don't try to move the broken bone. Call an ambulance. The person should be rushed to the hospital immediately, because there the bone has to be taken into the X-ray department, and X-ray has to be taken, and then the plaster has to be put for the bone. Sprain. A sprain is an injury in a muscle or a joint. If someone has had a sprain, follow these steps. Now sometimes when you get up early in the morning, you feel there's a catch in the shoulder, or you feel there's a catch in the back, or you feel there's a catch in the leg. Now that is a sprain. When by accident a sort of injury happens, the ligaments or the muscle gets pulled, it is a sprain. And what should you do when you get a sprain? Rest the affected part on table, chair or stool. Place some ice cubes in a towel and wrap the cold towel on the injured area. So take a towel and wrap it around some ice cubes and keep it on the infected area. That reduces the pain. Apply a gel to relieve the pain. You can use Iodex or Tiger Balm on that particular part. Rub it gently and it relieves the pain. Do not move the injured part. Wrap a crepe bandage to prevent unnecessary movement. You must have seen people walking around with a slightly pinkish colored crepe bandage. That is called a crepe bandage. And if you have a sprain, immediately wrap that part with this crepe bandage so that movement is minimalized. Next one, if you get burns, that is usually you go to the kitchen and hot water falls on your hand, or while some people must have got burns yesterday while bursting crackers on Diwali. So what should you do when you get burns? Burns can be caused by steam, boiling water, fire or burning matchsticks. If the burn is severe, take the person to the doctor immediately. If the burn is minor, follow these steps. Now if the burns are of a major part, then immediately the person has to be rushed to the hospital. But if it is a minor burn caused by the matchstick or little boiling water on your hand or leg, then you need to follow these steps that are given in the textbook. Make the person lie down. Place a clean cloth over the burnt area. This will protect the wound against germs. If the clothes have caught fire, cover the person with a blanket. Now if the clothes have caught fire, it will keep on burning. So what you do is you have to cover the person with a blanket and roll the person so that the flames are put off. Now the idea behind covering the person with a blanket is because a blanket is a bad conductor of heat. That is the idea underlying this purpose, and it will not allow the fire to burn. This will help put out the fire. Next one. Do not try to break the blisters formed on the person's skin or remove bits of cloth sticking to the burnt area. Now when a person gets burnt, you will have the skin burnt, pinkish color comes, and immediately blisters will follow, come up. Now blister is nothing but it's accumulation of water inside that, but don't try to burst the blister, that will become septic. And second thing, if there are clothes, pieces of clothes sticking to the burnt areas, don't pull it out, because when you pull the cloth out, you will be pulling the skin also, and that causes a lot of pain to the patient, and it is infectious too. Rush the person to the hospital immediately. So if there is major burns in the body, the best thing that you can do is take the person to the hospital. With this, I come to the end of the first part of the lesson. Your homework will be to draw the picture of an arm in a sling on page 208, and then first aid for minor cuts, the 3 steps shown on page 207. 3 steps shown for first aid for minor cuts on page 207, and arm in a sling for homework. Please draw them in the notebook. Thank you.